A 5-year-old boy is brought to the office due to persistent cough. His symptoms began with a mild upper respiratory illness 2 weeks ago, but the cough has progressively worsened, and now spells of dry cough are often followed by vomiting. The patient has not received childhood vaccinations due to parents' beliefs. He recently returned from a summer camp. On physical examination, the patient is afebrile and lungs are clear to auscultation. Testing of respiratory secretions shows gram-negative coccobacilli. Which of the following is most likely involved in the pathogenesis of this patient's symptoms? Our patient who has started off with having mild cough that has been persistent and has progressively worsened, and now he is having a spells of dry cough, which is indicative of a whooping cough followed by vomiting, is most likely having a pertussis infection. Pertussis most often is going to rapidly grow through airborne droplets in communities with low tetanus, diphtheriasis, and pertussis vaccinations. So let's write this down. Pertussis most rapidly spreads through airborne droplets in communities with low rates of tetanus, diphtheria, and pertussis vaccination. Now, just to review, tetanus and diphtheria are both gram-negative rods. Tetanus will present with hypertenosity and muscle spasm, and diphtheria will present with severe pharyngitis. Now, our patient had a mild cough in the beginning, and this is what often occurs with a pertussis infection. It starts off with a mild cough as well as a runny nose, rhinorrhea, and then it progresses to a paroxysmal cough or a sudden increase in cough. Afterwards, what can happen is inspiratory whoop as well as vomiting. Pertussis is going to bind the respiratory epithelium. Once it binds the respiratory epithelial cells, it is going to release a exotoxin. Right, so it releases exotoxins. The two exotoxins that we're going to talk about that it releases is tracheal cytotoxin. Cytotoxin is a toxin of the cell, and it literally kills the ciliated epithelial cells found in the trachea. These cells are responsible for motility and airway clearance. So if we kill these cells, that results in a decrease in airway clearance. As a result of a decrease in airway clearance, what can occur is microaspiration. Aspiration refers to the notion of when you swallow, the bolus going through the wrong hole to the airway or to the lungs. And microaspiration refers to aspiration of small amounts of food or liquids going to the lungs. This decrease in airway clearance will also result in paroxysmal cough, because now we're trying to cough to clear the airway, which would have been the job of the ciliated epithelial cells. The other exotoxin that is important that we're going to talk about is the pertussis toxin. The pertussis toxin is a EV toxin. It is going to go into the cell and it is going to activate adenylate cyclase. The activation of adenylate cyclase results in changes to intracellular signaling, which ultimately results in two things. The first thing is going to be a inhibition of the job of phagocytes. This is going to make it easier for the bacteria to grow, and then it can cause leukocytosis, which is a increase in white blood cells. If we take a look at our answer choices, we talked about how the tracheal cytotoxin, which was released by pertussis, would result in loss of respiratory epithelial cells, and we see that with our answer choice E. So the answer is going to be E. Loss of ciliated respiratory epithelium cells is involved in the pathogenesis of the patient's symptoms. Let's look at other answer choices and see why they're wrong. Answer choice A is alveolar influx of polymorphonuclear leukocytes. Polymorphonuclear leukocytes are immune cells that have granules. So example are neutrophils, basophils, as well as eosinophils. This occurs in bacterial pneumonia. What happens is there is a huge migration of neutrophils from the bloodstream into the alveoli in the pathogenesis of bacterial pneumonia. Bacterial pneumonia would also present with fever as well as a productive cough, meaning that there will be mucus in the cough. Our patient is afebrile and also does not have mucus in the cough. As a result, we can cross out answer choice A. Answer choice B is circulating endotoxin mediated vasodilation. This refers to the pathogenesis of gram-negative bacteria involved in septic shock. Okay, so let's briefly talk about that. So gram-negative bacteria, like E. coli, can cause septic shock. The way it does that is through releasing endotoxins. The most potent endotoxin found within gram-negative bacteria is going to be lipopolysaccharide, which is located in the outer membrane of the gram-negative bacteria. The virulence factor of lipopolysaccharide is going to be lipid A. Lipid A is going to bind to the toll-like receptors found in immune cells, and it is going to trigger IL-1 release. So it is going to trigger pyrogens. Like pyrogens are mediators that cause fever, so it'll release IL-1, IL-6, as well as prostaglandins. And it will also release inflammatory mediators like tumor necrosis factor alpha, as well as interferon. These are going to damage endothelial cells, and the damage in endothelial cells is going to increase vascular permeability. So we see an increase in vascular permeability, which then results in hypotension, and this hypotension can result in end organ failure if untreated. So answer choice A or answer choice B refers to gram-negative bacteria-mediated septic shock. So we can cross that one out. Answer choice C is interferon gamma-induced macrophage activation. This refers to tuberculosis. Tuberculosis is involved in interferon gamma-induced macrophage activation. So let's write this down. Tuberculosis is going to be involved in interferon gamma-induced macrophage activation, which results in formation of granulomas. So what happens is there is a tuberculosis infection. So let's say that this tissue is going to be infected with tuberculosis, represented by these red circles. What can happen is immune cells can detect this infection and then surround the tissue. The significance of immune cells surrounding this tissue is going to be so that the infection does not spread. It is also going to cut off nutrient supply to the tissue found inside the granuloma, and ultimately it is going to lead to the necrosis of the tissue found inside the granuloma, and this is referred to as caseous necrosis. And this is involved in the pathogenesis of tuberculosis. So we can also cross out answer choice C. And answer choice D is intracellular invasion of reticuloendothelial cells. This is talking about the pathogenesis of measles. In measles, first let's talk about reticuloendothelial cells. This refers to phagocytic cells, and measles starts off in the respiratory epithelium, and then it can advance to invading the reticuloendothelial cells. Measles presents with a cough that also the patient would also have a fever, as well as conjunctivitis or pink eye, as well as a maculopapular rash, erythematous maculopapular rash. Maculopapular rash refers to a rash that has both a raised and a flat part. So it is also not going to be answer choice D.